Hello and welcome to Drug Talk. I'm Matt Hamilton and today we're discussing fentanyl, how it affects the human body, and the sorts of mistakes that can be made with this drug. I'm joined here with Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you doing, Matt?
It's a pleasure to see you, sir.
As well.
Doctor, what is your area of specialty?
I am a clinical pharmacist. I specialize in drug interactions and those effects on the human body.
And as you know, I'm Matt Hamilton. I'm a drug error trial attorney. I represent the victims. Today we're talking about fentanyl. Dr. Garcia, is fentanyl the only name this drug is known by?
No, it is actually in many different forms. Typically, you will see it used in a patch form where it has a brand name of Duragesic.
Duragesic.
Duragesic is a brand for the patch. Then you'll have many formulations when you use a injectable, or you may have a nasal spray, or you can even use what's called a buccal, which is basically where you put it on the inside of the mouth, kind of in the inner cheek. So several different names.
It can be injected into your body.
Correct.
It can be taken in the mouth, or it can be a patch that's put on the skin.
And as well as a nasal spray.
And
There's
a nasal
formulations.
spray.
Correct.
What does fentanyl do in the body?
Well, fentanyl is a class of drugs, or in a class of drugs called opioids. So they basically hit certain receptors in the body that help to relieve pain.
I see. Okay. And is this a strong medication or a weak medication?
It is a very strong medication. You wouldn't see this typically used for your average, maybe you have a sprain or you had some surgery, post-surgery. You typically wouldn't see someone on fentanyl. You would see in more extreme cases of pain, or after, say, maybe hip surgery and you have chronic pain. This is a type of area where you would see the patches used, and injectables possibly in the hospital.
Can mistakes be made with the administration of fentanyl?
Sure. Fentanyl is metabolized through a portion of the body through a series of enzymes. And so it lends itself to having the ability to have some drug interactions. So what is imperative to understand is how the other drugs that you're taking could possibly interact with fentanyl, meaning you could have certain drugs that you take normally, and in combination with fentanyl, the level of fentanyl in the body may increase or it may decrease. And that could be just based on the simple fact of whether or not you're taking other drugs that could have nothing to do with pain.
Okay. So the pharmacy or the physician is supposed to catch the drug-drug interaction?
Correct. There should be checks on both ends, be it in the hospital in some cases, as we said, based on medications you're currently taking, at the pharmacy as well. They should be checking for those.
Okay. And you've mentioned several kinds of fentanyl. Do people change the type of fentanyl they use from one time period to another?
In some cases, yes. For instance, if you're in a hospital and you're getting injections, you typically see that through either piggyback injections on a IV bag, or you might see just direct injections into the IV line. Okay, just depending on what you're dealing with. So once you've been stabilized on that and they find out, okay, this is a dose that works great for you to relieve your pain, then the conversion factor comes in where you're actually converting it. We could go into that, but it can be a little cumbersome. But you basically convert it into the dose that would be equivalent if you were using a patch. And
can dangerous errors be made in converting it?
Of course. I mean, we're human and we are using math, right? And so computers are great when they work properly, but you always want to make sure you double check it with your own calculations. And so if you're taking, or if you do the conversion incorrectly, you might get a lower dose that is needed. But if you do it improperly, then you might wind up using a higher dose of a patch than need be.
So if the professionals are doing what they're supposed to be doing, should a drug-drug interaction ever occur with fentanyl?
It should not.
If the professionals are doing what they're supposed to be doing, should there be a conversion error?
There should not be a conversion error.
How are these mistakes being made then?
Well, it could be a number of different things. One of the things you want to make sure is you want to let the physician know, other medications that you're taking. There should be checks in place for that. So
they forget to ask.
They could forget to ask, they could forget to tell the patient. So when, if you're dispensing it out of a retail location, you would want to counsel that patient, especially if it's a new medication because it's stronger. The other thing is if you see a patient who's never been on fentanyl before and all of a sudden they're on, say, a high dose of a patch, that's an alarm. That should be something that you should stop at that point and say, hey, wait a minute, we've never had this before from our pharmacy. You may have had, you may not have had history with it. Why are we starting out at such a high dose? Because you don't really want to do that. You want to use the smallest amount possible that relieves the pain. And we would know that if we're starting out at a high dose.
Well, should the doctor, the professional, or the pharmacist inform the patient as to any symptoms to look for if they're starting these drugs?
Sure. So this medication can cause a few different, say, problems or things that you need to be aware of. One of which is respiratory depression. So when the dose becomes too high, it can cause the body to decrease the respiratory drive, so to speak. So the body, nothing that you're doing yourself, but the body just doesn't have the same drive to produce, or not to produce, but to consume or to ingest oxygen, basically to get it into the bloodstream.
It can kill you.
It can kill you because you're not getting enough oxygen, or if you're not getting enough oxygen and you don't die, you could potentially have brain damage because you're not getting enough oxygen to the brain.
Okay, all right. Are there any allergy type symptoms to look for?
You definitely want to look for a syndrome called Stevens-Johnson syndrome, which is basically a life-threatening rash. It starts out as a rash typically kind of on the neck, chest area. And the difference between this rash and your typical rashes are going to be those, if you had maybe an allergic reaction to laundry detergent, you'd have a little bit of red mark. This is going to be more deep purple, almost looking at like a bruise.
It's not a red rash, it's like
It's a purple. It's purple.
Okay.
Okay, that's kind of the distinct rash. And untreated, it could potentially lead to another condition called toxic epidermal necrosis, which is basically when that rash covers more than 30% of the body and it becomes an issue where you can no longer manage heat. Your body's not protected more. We've discussed that in length before, and so that video is available as well on the website if the
So if somebody's
patients want to
starting
know more
on
about
fentanyl and they're having flu-like symptoms or they're having a purple rash, then they need to, that's a symptom they need to look for.
That's a symptom they need to be mindful of, and definitely, let the physician know, whoever prescribed the fentanyl, hey, listen, I'm getting this rash. I'm having trouble breathing. I feel like I'm out of breath. If you were, normally able to walk up a flight of stairs and not be out of breath, but now when you've started this medication, you start to feel that, like, oh, I get to the top of the stairs and I feel out of breath. That's something you want to let them know.
Okay, all right. Well, Dr. Garcia, thank you. It's been a pleasure talking with you. We've been discussing fentanyl, the mistakes that can be made, and how it can affect the body. I'd strongly encourage you to look at our website, worldwideweb.law-kc.com. It's got a lot of useful information, both on fentanyl, the other drugs, the mistakes, and the harms that can be produced from them. It's a good research tool for you. I'd also like to strongly encourage you to watch our videos on Stevens-Johnson syndrome, necrolysis, toxic epidermal necrolysis,
Yes, sir.
And the other fentanyl videos. They'll provide good information that you'll want to see and use in your research. I'm Matt Hamilton. It's been a pleasure seeing you, Dr. Garcia.
Thank you.
And this has been Drug Era Talk. Thank you for joining us.